Let's go to health now, where the Coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, says the federal government will not tolerate corruption in the health sector, warning that diversion of public resources costs lives. Professor Pate stated this in Abuja during the inauguration of a joint task team between the Federal Ministry of Health and Social Welfare and the Independent Corrupt Practices and Other Related Offences Commission, ICPC, established to identify vulnerabilities, strengthen preventive controls and improve accountability across the health sector. He highlighted measures already being implemented, including the deployment of performance and financial management officers to the 774 local government areas, digital tracking of health funds, verification of beneficiaries and stronger oversight of the Basic Healthcare Provision Fund.
This Ministry of Health and Social Welfare, we will not tolerate corruption. But an effective system does not simply respond to wrongdoing after the fact. It identifies the vulnerabilities early and closes those loopholes before the resources are lost. The federal government, as you all know, under His Excellency President Bola Ahmed Tinubu, is committed to delivering a health system that Nigerians can trust. One where resources are used for their intended purpose and our institutions increasingly work with the highest levels of integrity. And it's only not a destination. Building state systems, building institutions takes time. It takes a lot of effort. Sometimes you right, sometimes you falter. But the key is that you learn from every step and improve.
The establishment of this joint task team gives practical expression to the MOU between ICPC and the Federal Ministry of Health and Social Welfare signed sometime in October 2025 and represents a shared commitment to strengthening the transparency, accountability and integrity in Nigeria's health sector. The MOU provides a practical framework for the collaboration and preventive oversight in the management of health sector resources, particularly the Basic Healthcare Provision Fund. Its purpose must be reflected in concrete outcomes. Funds allocated for primary healthcare must reach the facilities and people for whom they are intended and must be utilized transparently, efficiently, and in accordance with due process.